On page 174, we see some of the newer anti-epileptic drugs after using the traditional ones for a long time. There's some others that have been successful. And 175 has the table that talks about these drugs. And the first one that's listed is a drug called oxcarbazepine. Oxcarbazepine, so it's kind of hard to say. And you might end up wanting to get them mixed up with carbamazepine, but they are different. The trade name is Trileptal. These also work in sodium channels. They block them so that not as much sodium can get in to the cells, and that sedates them a little bit, calms them down, requires greater stimulation if they're going to send abnormal signals. It's common to see dizziness, drowsiness. The person might have headaches, some nausea. In severe cases, it might cause amnesia, and it can affect the sodium level. Remember from freshman term, normal sodium, and junior term too, you will review these, but the normal sodium level in the body is 135 to 145. And these can cause low sodium levels because they're controlling the amount of sodium in the head. So we know that low sodium levels can lead to some problems. They don't interact well with diuretics that make you excrete sodium. The whole action of a diuretic is to get rid of sodium because we know that water follows salt. So diuretics are going to cut down on the amount of the person's sodium as well as this Trileptal. So the person can end up with a shortage of sodium in their body, and that's not good. For nursing implications, you need to tell the person to watch out for changes in vision. If their vision blurs, that could indicate a problem. They need to report any weakness or change in mental status, and they need their sodium levels checked. They should walk very carefully up and down stairs, especially. They should hang on to handrails and watch for anything that makes them dizzy or could add to that falls risk. On page 174, we see a few patient and family teaching points when it comes to this Trileptal. And one really important thing is they shouldn't drive or operate heavy machinery because their vision can blur and they can be drowsy. So, and generally speaking, people who have seizure disorders have to have people drive them or take public transportation. I don't know if the requirements are the same in every state, but I think in Tennessee you have to go 6 months seizure-free before you're allowed to resume driving, and so the person has to just see how these medications affect them. The next drug is a drug called lamotrigine or Lamictal, and this can be used for partial seizures as well as the more serious grand mal tonic-clonic seizures. There are seizures associated with something called Lennox-Gastaut syndrome, which is genetic, and some types of bipolar disorders will present with seizures. This drug can cause drowsiness, can cause trouble seeing, clumsiness. The person might have some abdominal pain as well as being dizzy. So once again, a falls risk. The biggest problem with this, the biggest adverse reaction you might see is a rash that could indicate Stevens-Johnson syndrome. If you're not familiar with that, you need to look it up. It's pretty horrendous, but it causes blisters to form and the skin literally sloughs off. The treatment for people with Stevens-Johnson syndrome most of the time is admission to a burn unit, and depending on the severity, they might need to go into an induced coma while their skin is treated. They might even require skin grafts. It also can cause a folic acid deficiency, but that can be remedied. It's the rashes you need to watch out for, especially in children. Any kind of a new rash on a child, you need to consult the healthcare provider just to make sure that it's not the start of an adverse reaction to Lamictal. When it comes to lamotrigine or Lamictal drug interactions, you can see there's quite a few drugs here that do not work well together. So this would take, sitting down with the patient and kind of going over what each of these drugs might do. Even aspirin and Tylenol can cause a problem, as well as oral contraceptives. So quite a few drugs don't mix well. Usually they're going to start a person out on a starter kit to see how Lamictal does for them. You want to notify a healthcare provider if a rash develops. They're probably going to draw folic acid levels to make sure that you are getting sufficient amounts. In Black patients or patients of African descent, there can be differences in renal clearance rates that could cause a toxic buildup of lamotrigine, and so renal function studies also have to be done. Patient and family teaching is found on page 176. So make sure you look over that. Let me know if you have any questions. Now, another drug that you might mix up with lamotrigine or Lamictal is lacosamide. Remember, there's Lamo and Laco, but the trade name for this particular drug is Vimpat. It also controls sodium channels. It's an amino acid, and it stabilizes the blood or the brain cells by controlling the amount of sodium that goes in and out. Side effects, once again, many of these have the same side effects: blurred vision, ataxia, dizziness, fatigue. So it's just something we have to warn every patient about. Now, this drug is different from some of the others in that people have reported a feeling of euphoria. This drug makes them feel wonderful. Euphoria is excessive happiness. And unlike the lamotrigine or Lamictal, Vimpat can cause the person to be exceedingly happy, which sounds like a good thing, except people get very dependent on that feeling of extreme happiness, and they might take this drug in ways they shouldn't. They can get psychologically dependent. It also can cause the blood pressure to drop, causing the person to become dizzy. Drug interactions, once again, cardiac meds, drugs for blood pressure, psych drugs, patients taking HIV meds, antifungals, and then drugs for tuberculosis can react badly when it comes to being on Vimpat. So with lacosamide or Vimpat, you want to assess the patient's blood pressure and other vital signs. Watch for orthostatic hypotension because of all the risk of falls. You want the patient to change positions very slowly, like you do for any drug that has orthostatic hypotension. The patient's vision can change, so tell them to watch out for blurred vision, difficulty seeing. Remind the patients to take this drug according to directions. Don't just take it because they like how it makes them feel, even though it's tempting. Once again, because of vision changes, they should either avoid driving or don't drive unless they know how it's going to affect them. IV infusions need to be given over a period of at least 30 minutes to an hour. They can be irritating. Make sure you get baseline vital signs before they take this med. And make sure you read Patient and Family Teaching on page 177.